Thera-D, also known as vitamin D, is a fat-soluble vitamin that helps your body absorb calcium and phosphorus, which are important for building and maintaining strong bones. It is used to treat and prevent bone disorders such as rickets and osteomalacia. Thera-D is also used to treat or prevent bone loss, known as osteoporosis, and to treat low levels of calcium or phosphate caused by certain disorders. It may also be used in kidney disease to maintain normal calcium levels and allow for normal bone growth. Vitamin D drops or other supplements are given to breastfed infants because breast milk usually has low levels of vitamin D. The recommended daily dosage and optimal timing for taking Thera-D should be determined by a healthcare professional. When taking Thera-D, it's best to take it by mouth as directed. It's recommended to take it after a meal, but you can also take it with or without food. If you're using the liquid form, make sure to measure the dose carefully using a special measuring device. If you're taking the chewable tablet or wafers, be sure to chew the medication thoroughly before swallowing. For rapidly dissolving tablets, simply place the dose on your tongue and allow it to dissolve completely before swallowing. It's important to take Thera-D regularly to get the most benefit from it. If you're taking it once a day, try to take it at the same time each day. If you're taking it once a week, remember to take it on the same day each week. If your doctor has recommended a special diet while taking Thera-D, such as a diet high in calcium, make sure to follow it closely to get the most benefit from the medication and to prevent serious side effects. And as always, if you think you may have a serious medical problem, seek medical help right away. When taking Thera-D, it's important to be aware of potential side effects. Vitamin D at normal doses usually has no side effects, but if you experience anything unusual, contact your doctor or pharmacist right away. It's important to follow your doctor's instructions when using this medication, as they have determined that the benefits outweigh the risks of side effects for you. Most people using this medication do not experience serious side effects. However, too much vitamin D can lead to harmful high calcium levels. If you experience symptoms such as nausea, vomiting, constipation, loss of appetite, increased thirst, increased urination, mental/mood changes, or unusual tiredness, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects not listed, contact your doctor or pharmacist for guidance. As for the ideal dosage and timing, it's best to follow your doctor's recommendations. They will determine the appropriate daily dosage and the optimal timing for taking Thera-D based on your individual needs and health condition. Before taking Thera-D, it's important to let your doctor know if you have any allergies to vitamin D or other vitamin D products. This product may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. Make sure to inform your doctor about your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, kidney disease, or liver disease. If you're using liquid products, chewable tablets, or dissolving tablets, be aware that they may contain sugar and/or aspartame. Liquid products may also contain alcohol. If you have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's important to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, discuss with your doctor whether doses of vitamin D greater than the recommended dietary allowance are necessary. As for breastfeeding, consult your doctor before using this medication. When taking Thera-D, it's important to be aware of potential interactions with other medications. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential complications. Some products that may interact with Thera-D include burosumab and phosphate binders. Additionally, be sure to check the labels on all your prescription and non-prescription/herbal products, as they may contain calcium, magnesium, phosphate, or vitamin D. It's best to ask your pharmacist about using these products safely. It's important to note that vitamin D is very similar to calcitriol, so it's best to avoid using medications containing calcitriol while taking Thera-D. Lastly, be aware that vitamin D may interfere with certain lab tests, such as cholesterol tests, potentially causing false results. Be sure to inform lab personnel and your doctors that you are taking this vitamin. As for the best time to take Thera-D, it's best to follow the dosage instructions provided by your doctor. If someone has taken too much Thera-D and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and irregular heartbeat. During the use of Thera-D, it is important to have regular lab and medical tests to monitor levels of calcium, magnesium, and phosphorus. Make sure to attend all scheduled medical and lab appointments. It is also recommended to consult your doctor for more specific details. Additionally, vitamin D-rich foods such as fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish can be included in your diet to support the benefits of Thera-D. If you forget to take a dose of Thera-D, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. When storing Thera-D, make sure to keep it at room temperature and away from light and moisture. It's important to store alpha-calcidol drops in the refrigerator, but do not freeze them. Remember to keep all medications out of reach of children and pets. When it comes to getting rid of Thera-D, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly dispose of this product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.